Welcome to Please Me, the podcast bringing you bold conversations and big clit energy. I'm Eve, your host, on a journey from trauma to sexual liberation. This week, I want to give a shout out to my most favorite subscribers, Paul Thomas and Shelby Caples. Thank you for your continued monthly support. I'm also shouting out my top 5 countries: United States, Bangladesh, United Kingdom, Czechia, and Canada. And my top 5 cities are Shrewsbury, New Jersey, Seattle, Washington, San Jose, California, Atlanta, Georgia, and Boston, Massachusetts. Please Me has been listened to in 114 countries and counting. Thank you for your support. Did you know that podcasts rely on listener support to keep bringing you the content you love? For ad-free listening and exclusive content, join me on Patreon for early releases, bonus episodes, and more. See show notes for the link. Please Me is for mature audiences. Sit back, relax, and surrender to the pleasure of Please Me. Hello, and welcome to Please Me, the podcast that aims to destigmatize conversations about sex and sexual health by turning the sheets into our classroom. Today, I'm so excited to be talking to you about erectile dysfunction. Erectile dysfunction is one of those conditions that can creep up on us, right? And it is something that is very treatable in a physical therapy practice. And so I wanted to come on and talk to you about that today. My name is Eve Hall, and I am the host of Please Me podcast, and I am also a licensed physical therapist that treats conditions of sexual health and the pelvic floor. And there are many reasons why a person might have erectile dysfunction, and so we're going to get into all of that today. Erectile dysfunction is a very common condition that affects 20% of men in their 20s, believe it or not, 30% of men in their 30s, 40% of men in their 40s, 50% of men in their 50s, and it goes up 10% per decade. It's very, very common, and unfortunately, lots of people are experiencing it, but very few people are talking about it. And so a lot of times people will go years and years without seeking any kind of medical help, when really there is a lot of options out there in terms of getting treatment. So erectile dysfunction is basically when you are not able to get an erection that is long enough to fully enjoy sex and penetration. And its prevalence, we already talked about, is very, very common. 50% of men in their 50s have erectile dysfunction, but a lot of times people don't know that 20% of men in their 20s actually start having some form of erectile dysfunction. So when you think about normal function, think about when you were a teenager and the wind would blow and you would get an erection, right? Or you would wake up with morning wood. Those are normal functions, and that is how the penis should be responding on a regular basis. And a lot of times people will start to lose that function, lose those morning woods, right? And start losing the ability to have erections throughout the day. Those are 2 signs that your erectile function is decreasing. I want to talk about premature ejaculation because a lot of times people don't understand that those 2 things are really linked, right? Premature ejaculation is actually a precursor to erectile dysfunction. And so the definition of premature ejaculation is ejaculating too soon when you are in partnered sex. And typically it's defined as having an orgasm within 1 to 2 minutes of beginning penetration. So it's a very common thing to have if you have erectile dysfunction. And so one could play into the other. There are physical causes of erectile dysfunction. And typically what happens is there are blockages in the blood vessels that go to the penis and surrounding genitalia. And those blockages are often caused by nutrition. So we're going to get into that in a minute. Okay. But there are treatments to unblock those blockages. So we are also going to talk about that. The difference between erectile dysfunction and premature ejaculation is that erectile dysfunction affects the ability to get or keep an erection, and premature ejaculation impacts the timing of the ejaculation, but they go hand in hand. A lot of times people that have premature ejaculation are also suffering from erectile dysfunction. So some of the physical causes of erectile dysfunction can be cardiovascular disease or increased cholesterol, high blood pressure, obesity, diabetes, and hormonal imbalances like low testosterone. So finding out what those hormonal imbalances are can really help to improve your erectile function. And if you find that once you've done that and your testosterone levels are now normal, but you're still experiencing erectile dysfunction, it could be coming from some of those other causes. There are emotional causes that also can affect erectile function, such as stress, anxiety, depression. Those things can also hinder our performance in the bedroom and can also lead to erectile dysfunction. There's relationship issues. You can have, sometimes people will have pressure to perform, right? And that can also cause erectile dysfunction issues. And then just having regular insecurities, right? And I just did a talk about how to get big clit energy, but I've done one in the past about how to get big dick energy. And really having, confidence in the bedroom is really helpful in order to have normal erectile function. So gaining that insight is really important. Then there are psychological causes. Performance anxiety, like I just mentioned, fear of not being able to perform in bed, and then mental health issues like depression, stress, and unresolved trauma can also contribute to erectile function and dysfunction. Let's talk about nutrition because I mentioned it before, and nutrition is so important for erectile function. What we eat in our body affects our health in general. And I like to say 80% of health is nutrition. The other 20% is getting enough sleep, getting enough water, and exercising on a regular basis. Okay. And that falls into the 20%. So 80% is actually nutrition. And nutrition is extremely important in order to be able to have normal erectile function. When you have a diet high in cholesterol, high in processed foods, high in meat intake, which has normally high cholesterol levels, that is going to cause blockages in your arteries to form and in your blood vessels to form. And erectile dysfunction is a blood flow issue physically, if you're looking at just the physical manifestation of it, not the emotional or psychological. So if we're looking just at the physical manifestation, it is a blood flow issue because there are blockages in the blood vessels. And so it is extremely important to make sure that you're eating a diet full of fruits and vegetables. One thing that I do recommend is Juice Plus. And Juice Plus is basically, it comes in capsule form or it comes in chewable forms. And it gives you the ability to get 30 fruits and vegetables in your body every single day. And it's really incredible. I like the chewable ones. I take them every single day and it just keeps my arteries healthy. And it has been shown in studies to help your endothelial health. And the endothelium is the lining of your blood vessels. And it is important to have that lining very healthy so that the blood will flow well throughout your body. And of course, to your penis as well. So I suggest that you try Juice Plus. Juice Plus is something that is available on my website. You can go to pleaseme.online and learn more about it there. And you can also order it as well. So I want to talk about foods that can help with erectile function. And one of those things I love to talk about is watermelon because watermelon has natural citrulline in it. It's a chemical micronutrient that comes in watermelon naturally. And basically it is nature's Viagra. It helps to open up the blood vessels. And so I challenge you to do a 1-week watermelon challenge. Take 4 cups of watermelon every single day and eat it either in a smoothie or you can eat it like that. Try not to juice it because that takes out all of the fiber. So we definitely want to have the fiber, okay? And the citrulline is going to help to open up those blood vessels. So that is a really great place to start. Of course, leafy greens like spinach, beets, citrus fruits, and nuts all promote better circulation. And then omega-3 rich foods like salmon, flax seeds, they also support cardiovascular health, which are vital for erectile function. And if you go again to pleaseme.online, the Juice Plus that I mentioned earlier also has an omegas that I think is the best omegas you can find on the market because they are plant-based and they're not getting the omegas from the second party, which would be the fish, right? Which is where a lot of the omega supplements come from. So you can get them directly from the plants, which is where the fish get them from. And it's a great source of omegas, and I take those every single day. And then let's talk about the gold standard of erectile dysfunction treatment. And that is called acoustic wave therapy. And basically what acoustic wave therapy does is it's sort of like an ultrasound machine. It has a wand and you move it along the penis and the surrounding tissues of the genital area. And what it does is it breaks up the blockages in the blood vessels and it allows them to safely flow out of the body. And over time, over various treatments, it increases capillary formation. And capillaries are actually the tiny little blood vessels that are all over your body that go to every single cell in your body. And it is very important to have more capillary formation because as time goes on, our circulation decreases. So we really want to maintain that circulation to the genitals in order to have proper function. I offer this treatment in my practice, Inspire Health Physical Therapy and Wellness. And if you are listening to this talk and you are interested in getting treatments, or you're interested in doing some coaching around erectile function, I am certainly willing to help you. And so I would love for you to reach out to me on pleaseme.online. The reason why acoustic wave therapy is the gold standard is because clinical studies have shown that it is very effective and it's safe. And it is a non-drug alternative for erectile dysfunction treatment. And when you're taking the little blue pill, right, Cialis or Viagra, those come with a lot of side effects. And this has no side effects whatsoever. Plus, it's targeting the root problem of the issue and not just putting a Band-Aid on it like the medication does. So at this point, I just want to say thank you for listening, and I would love to help you if that's you out there and you're listening and you feel like you need some help, whether it be coaching for nutrition, or you can do coaching for the emotional and psychological aspects of erectile dysfunction, or you need treatment for the physical aspects of erectile dysfunction to open up those blockages in and around your genitalia. Please feel free to reach out to me on pleaseme.online, and there's a contacts page, and you can go there and you can send me a message and I will send you the link to my scheduling page, and I would absolutely love to help you. I just want to leave here saying that there is absolutely no shame in seeking treatment for your sexual health conditions. Everyone deserves to feel confident and connected to their bodies. Remember that you're not alone in this journey, and reach out today and let's work together to restore your confidence and your health. Until next time, are you suffering from erectile dysfunction in silence? Are you embarrassed by premature ejaculation? Is it hard to get an erection that is long enough for penetration or that lasts long enough to satisfy your partner and yourself? Just know that you are not alone and that 20% of men suffer from erectile dysfunction in their 20s, and it goes up 10% per decade. So 50% of men in their 50s will have some form of erectile dysfunction. My name is Eve Hall, a licensed physical therapist who treats conditions such as erectile dysfunction and other sexual health conditions. I'm here to tell you that there is a solution to erectile dysfunction, and I offer the gold standard in my practice called Inspire Health Physical Therapy and Wellness. I have a full protocol to get your sexy back, so know that I am here to help. Just know that there is no shame in having any sexual health condition, including erectile dysfunction. If that is you, be sure to reach me on sdc.com and leave me a message there, or reach me on pleaseme.online to listen to my podcasts or to leave me a message and book an appointment today.